Sort of to wrap up and end and sort of put a bracket on the other end of our discussion, we're going to talk a little bit about public policy, and we're going to talk about politics. Clearly not Democrat-Republican politics, but the politics of communities and the politics of sort of who decides what happens in a community and where resources are allocated. And so I would love to have Valerie Bassett come up and give you the benefit of her experience in that area, and also to give you an idea of the kinds of things that are going on in the legislature in Massachusetts around this issue. Thank you.
Good evening. So I am PowerPointless as well, so I'm going to have to look at you, and vice versa. So is anybody here in public health? We've heard nursing, nutrition, great, small, sprinkling, yes, fantastic. Right, public health perspective. So I'm going to say 2 words about that, and then a word about the organization that I had, the Massachusetts Public Health Association, and then talk about policy approaches to changing the environment we live in to make it easier for people to make healthy decisions. That's really our framework. So public health, 2 things. One is if you think about Dr. Geller's single sort of discs adding up, you know, a doctor or in general healthcare providers seeing individual one at a time, or in this group setting, a circle. Public health is really the forest analogy in terms of really looking at the population as a whole. What are the huge trends that we see about public health challenges, public health assets in communities? What are strength factors, like having social support networks that make communities and individuals strong? So not looking at the individual, but really looking at the big levers. You know, a classic one is thinking about clean water. Right, so before clean water, a lot of diseases, and in places where there are not good systems for clean water, a lot of disease. So that's and the other side is obviously prevention. So public health being using what we know about population health to prevent you nurses from having patients, or to make sure that your patients are as well as possible when they come into you. And the other side I'm going to say a little bit more about is to make sure that the world that people walk out into once they leave a healthcare clinic or whatever healthcare setting's doors is one that promotes wellness and health. So Massachusetts Public Health Association, what we are is a nonprofit advocacy and education organization, and we try to promote policies at the local, state, and national level that make the community healthier. And we also try to engage people to really build a movement for public health so that people understand what public health is, why healthy communities matter, and that communities and people have a say in decisions that affect their health. I'm going to come back to that. I think it touches on a lot of things we've talked about earlier about part of good health and part of making these changes is making sure communities are organized and strong to actually influence the laws, influence the stores in their neighborhoods, influence the food in their schools, so that we can be healthier. So I have till 8, is that right? Okay. So we've heard a lot about some of the environmental causes for this recent, really pretty historically recent trend in the really, not only the increase in weight, but I want to point to the increase in chronic disease and the preventable part of it, because I think we've also heard really interesting things about what is the social meaning of weight, and that is a very important and complicated conversation as well. But one thing I think we can say is that the forces that make it harder for people to make healthy choices have increased. So how do we turn some of that around so that we can have a greater chance to be healthier? I'm going to talk about a few of the policy measures, both locally and state in particular, that are the best levers we know that are being studied and that are emerging to try to make these changes. Because we know we can do important things in treatment and individually and sort of in small ways, but we can make a huge change when we try to change things at a broad state level, and we can make a change that lasts. Because while Dr. Geller is doing amazing work, while the FIT program is amazing, if those people or those programs leave, what's left behind? We want to leave sustained changes that will stay permanently. So there's 4 categories that I'll talk about. One is how do we change the ratio of healthy food to unhealthy food, and especially looking at, we see this as a health equity issue because we know in poor communities and communities of color that there are a lot more junk food outlets, there are fewer grocery stores, so the ratio is off, right? If you think about a ratio of how easy is it to get healthy food like produce, like fruits and vegetables, versus get fast food. We want to get that ratio at a healthy level everywhere so that some communities aren't way up here and some way down here, like Andover versus Lawrence. So I'm going to talk more about ways to do that, but there's a number of ways to approach it. Another category is how do we make sure there's enough safe public space for people to exercise in, to walk, to bike, to do whatever to play. How do we make sure that there's safe public space? And then how do we think about public information and commercialization? Again, kind of either how do we have the right ratio of healthy messages about food and physical activity compared to messages, largely in the form of commercials, about unhealthy food or promoting us to all kind of sit on our butts. So how do we get that ratio right? And then the final 4th category is how do we engage communities and you and me in making these changes? So it's an important goal in itself to actually organize and mobilize and engage people to change policies because it's not going to happen otherwise. So within those categories, a few of the ways that are most promising are, if we look at the local level, there's a lot going on in Massachusetts. I'm going to focus on the state level, so I'm just going to say a couple things here. We look at some of the things that Somerville did, for example, and a really comprehensive approach. So looking at changing the food in schools. A lot of kids we know eat, the majority of their calories in school settings. So if we change the food, the ratio of healthy to unhealthy food there, we can have a big impact. Likewise with physical activity in schools, after schools, and childcare settings, that is a powerful lever for change. So school wellness committees is also a really important local effort around that. Looking at food policy councils, so looking beyond just the school, but looking at communities like the Worcester. Is anybody here from Worcester? So Worcester has a food policy advisory council that's looking at how do you promote farmers markets year-round and in all neighborhoods? How do you promote community gardening? How do we sustain, again, getting fruit in corner stores? So that's really important work that food policy councils can do locally. I'm going to come back and talk about statewide. How do we make changes so that when a town or a region is planning a new major development, they make sure to include enough parks and green space and sidewalks and make it close to public transit so people without cars can get there, and we're encouraging people to do things other than drive. And there's a really exciting statewide program. Actually, Harvard Pilgrim Healthcare Foundation is one of the founders of Mass in Motion, that the Department of Public Health is giving grants around the state to municipalities to make these kind of changes at the local level. So that's something very exciting happening in Massachusetts. And then you have other efforts to maybe really limit your exposure to unhealthy foods, like trans fat bans, or limiting where you can, vending machines with soda and junk food, limiting what's in those vending machines. So that's a part of the approach. So let's think about, if you scale that up from local efforts, a lot of the same policies we're talking about at the state level, and a lot of them are in play right now. I'll talk about a couple things that have been done pretty recently, and then some things that right now are in play, many of which my organization and folks we partner with are working on. And if you're interested in working on them and getting involved, our website is mphaweb.org. And you can come and see me after. I can connect you with us, because we are all about trying to get people involved and trying to advocate for these changes. So we can come and do trainings, we can bring you to the State House, we can do all kinds of things, give you fact sheets, or give you ideas about when and who to call to try to make these things happen. And there's a lot of other good folks working on these issues and similar ones as well. So the things that we've done. One thing that I would say is that by passing health reform and having more people insured, This is a little upstream in terms of, dealing with people who are getting in treatment. But if people who are, there's a trend towards medical home, and we're talking about payment reform in Massachusetts. If health reform can lead to a model of care that allows more people access to not only that one-on time with a physician, but time in a group, time with a nutritionist, time with someone who can connect them to resources in their community to exercise, that's a very good thing. There's some other things that have happened in terms of state regulation that are good and promising. One is a restaurant labeling regulation that the State Department of Public Health passed. I know some people are familiar with that, it looks like. That would require the posting of calorie information on chain restaurants so that people can make informed decisions. Another is around requiring body mass index testing in schools and reporting with information to make sense of that to families. And another is pretty exciting, the Healthy Transportation Compact. So last summer when the major state transportation overhaul was passed, who knew there was actually a health component, something called the Healthy Transportation Compact, which will require that the Executive Office of Health and Human Services have a person on the state team to do transportation planning. So they actually physically have to have a person thinking about health in all the state's transportation planning. It will also require that health impact assessments be done on major transportation planning so that in doing, again, any major road improvement project or new project, they'll have to think about what are we doing to make sure that this is accessible, that this has accommodations for pedestrians and for bikes. So those things are good. They'll all require support to be enforced and carried out well. Some things that haven't happened yet that we're still working on that you all can make a difference in are, one, there's a couple things around school nutrition. And I think that folks got, or there weren't enough copies that I brought. I didn't know how big the crowd was. But you made some more. Thank you very much. There's a list of bills that you've got in a past stapled packet that are in play right now on the issues I'm going to talk about. So I'm going to be really brief, but you can look at those and get ideas. And there's a number in our website on them if you're interested in more information. So there's a number of bills about school nutrition, but there are different approaches to how do you improve the health of the food offered. So one of them is around getting more Massachusetts produce in schools, because the data show that kids tend to be healthier and be a healthier weight when they eat more fruit and produce. So a great way to do that and support Massachusetts farmers is get more local produce into the schools. So the Massachusetts Local Farm Products Bill would do that. Another school nutrition bill is one that we've been working on for a long time to try to make healthier standards, nutrition standards for vending machines and for what's sold in school stores and school fundraising events, because that's where we know a lot of candy and soda consumption is. So there's a lot of alternatives. The evidence shows that places really haven't lost money if they switch over and cut out the unhealthy food, and there's a lot of great alternatives. So it's really time to get that done. We also want to improve the nutrition of the things sold on the tray. So we're looking at ways to do that. The Healthy School Meals pilot to try to enhance the state's match for school lunches for some schools that meet standards, higher, healthier standards for their school meals. And a few more. One, this touches on a topic mentioned earlier. How do you create kind of disincentives for people to, maybe drink so much soda or unhealthy food, and create funds so that you can put more grocery stores in neighborhoods where there aren't any. So there's a bill called the Wellness Trust Bill, which right now, in Massachusetts, there's no sales tax on food items, and that includes soda and junk food. And this would propose that instead you actually have a tax on those products that have certain high, beverages with a high sugar level, and on unhealthy snacks. And that those funds, part of those funds, then be used to create a fund that goes to fund getting healthier food into communities, so that you're not just sort of, making it a little bit more expensive for people to drink soda. You're actually putting money back into the community to make healthier food more available. And we know the data show that especially for young people, just like with a tobacco tax, if you put a tax on something like soda, it has an effect on what people drink. They will drink less soda, and that tends to be a good thing when we're talking about healthy weight. two more bills I'll talk about that are in play. One is around phys ed. We talked about how hard it is, especially in this economic climate and this MCAS environment,